Sterilizer Autoclave Solutions presents Optim1 wipes versus Super Sani-Cloth Germicidal Disposable wipes, a safety, efficiency, and cost-effectiveness comparison. The two products we will look at are Optim1 wipes, manufactured by Scican, and Super Sani-Cloth Germicidal Disposable wipes, manufactured by PDI. We will see if either or both are able to perform to the clinician's standards by meeting their key criteria, cleanliness and disinfection, while still being user-friendly and safe for the environment and equipment on a long-term basis. Let's start our comparison with the safety aspect. Both wipes are deemed safe for office use by EPA standards. However, there is quite a difference in their active ingredients, properties, and cleaning abilities. First, we will look at Optim1 wipes. Optim1 wipes' main ingredient is AHP, or accelerated hydrogen peroxide. AHP is composed of hydrogen peroxide, surfactants, or surface acting agents, wetting agents, which cause the liquid to spread across and penetrate surfaces better, and chelating agents, which help reduce the hardness of the water. Optim1 is non-toxic and non-irritating to the skin, eyes, and respiratory tract. It is listed as a Category 4, which is the EPA's lowest toxicity category, and therefore requires no precautionary or hazard warnings. The MSDS shows there are no special first aid precautions to be taken because it is a non-toxic formula. And of course, there are no firefighting measures for this non-combustible product. Next is Super Sani-Cloth Germicidal wipes. Super Sani-Cloth's main ingredient is isopropyl alcohol. This is a colorless and highly flammable alcohol, also known as isopropanol or rubbing alcohol. Super Sani-Cloths contain quaternary ammonium compounds, which are the chemicals that often allow a product to claim the antibacterial label. These chemicals are certified by the EPA as a pesticide. Super Sani-Cloths also contain C12-18 alkyl dimethyl chlorides that are surface disinfectants, and N-alkyl dimethyl benzyl ammonium chloride, which is a surfactant and disinfectant. Super Sani-Cloths use a combustible liquid and are an eye irritant. Because of these, they have a hazards HAZCOM classification for flammable liquid as A1 and eye irritation as Category 2A. Here the MSDS shows the various first aid measures to be taken for eye contact, inhalation, skin contact, ingestion, and firefighters. The MSDS also shows the precautionary statements for eyes, inhalation, and fire, as well as for proper storage and disposal. Now we will take a look at the disinfection qualities of both products. Disinfectants for medical surfaces must kill rapidly and thoroughly. There are two extremely important factors concerning environmental surface disinfection. The first is the contact time. That is the amount of time it takes for a virus, bacteria to be eradicated by a disinfectant. The second is the length of time surfaces remain wet after application. In order for a disinfectant to achieve germicidal efficacy, the product must remain wet for its entire contact time. In clinical studies of several disinfectants, including both Optim1 and Sani-Cloths, only the Optim1 was able to cover the entire surface with one wipe and remain stable for the duration needed in all tests. Super Sani-Cloths were able to disinfect, but it took up to 4 times the amount of wipes to complete the task. So then, what about cleanliness? Optim1's main ingredient, as stated earlier, is AHP, or accelerated hydrogen peroxide. AHP removes organic debris while disinfecting and delivering faster results on all surfaces. Optim1 can be used on anything from hard non-porous surfaces like tables, walls, and instruments, all the way to porous surfaces like upholstery, hoses, and instruments with plastic or rubber fittings. Super Sani-Cloths, on the other hand, contain many alcohol-based ingredients, and studies show that when you are using an alcohol-based disinfectant, the surface actually needs to be cleaned prior to their application. Alcohols are poor cleaning agents in the presence of bioburden. In fact, once the alcohol is used on bioburden, it becomes insoluble and stubbornly adheres to most surfaces. Because of this, the cleaning before disinfecting with Sani-Cloths does not happen, and it actually makes the residual bioburden stronger against the destructive effects of other chemicals. The SaniCloth formulation is only made for hard, non-porous, inanimate surfaces. Alcohol is known to slowly break down porous surfaces like rubber, plastic, and upholstery, so all your other equipment is not only being improperly cleaned, but it is also slowly being destroyed. In conclusion, it seems pretty straightforward that Optim1 wipes are non-toxic and are able to properly clean and disinfect everything in your practice with maximum efficiency and minimal cost. On the other hand, it's unfortunate that even though Super Sani-Cloth Germicidal Disposable wipes are a decent disinfectant, they are toxic, do not clean, and are in no way as cost-effective. Where safety, efficiency, and cost are the main concerns, it would stand to reason that of these two products, Optim1 wipes would be the product of choice.